I am pleased to discuss our recently published paper about the long-term outcomes after pediatric injury. About 6 million children are treated for an injury in the emergency department in the U.S. each year, with more than 150,000 of these children requiring admission to a trauma center. Previous single-center studies have shown that children hospitalized for a serious injury have a several-fold higher risk of residual functional impairment than those discharged from the emergency department. Although the long-term morbidity of pediatric injury has been established, measuring these outcomes is often challenging because of participant attrition, incomplete responses, and lack of resources for measuring and tracking outcomes. The purpose of this study was to identify factors available at discharge associated with long-term status that may be able to be used to identify groups that should be prioritized for follow-up assessment or post-hospitalization interventions. We conducted a prospective observational study evaluating the discharge and 6-month functional status of 323 children treated for at least one serious injury, an AIS score greater than or equal to 3. This study was conducted at the 7 Level 1 pediatric trauma centers within the NIH-funded Collaborative Pediatric Critical Care Research Network. The primary measure that we used to assess discharge and 6 months functional status was the Functional Status Scale, or FSS. This is a validated measure that assesses functions in 6 domains. A score of 6 or 7 defines good functional status, and greater scores show functional impairment. At discharge, functional status was abnormal in 25% of patients as measured using FSS. At 6 months, functional status remained abnormal in 10% of patients. In a multivariate analysis, the level of functional impairment at discharge was associated with the likelihood of 6-month impairment, a non-unexpected finding. Additional factors associated with a higher likelihood of 6-month impairment included older age, an injury sustained by a penetrating mechanism, and severe head or spine injuries. Although most seriously injured children return to normal functional status, ongoing disability remains 6 months after injury. We have identified several cohorts of children for whom long-term assessments should be targeted. Our findings support long-term assessments as standard practice for evaluating the health impact of serious pediatric injury.